to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for their acute and chronic medical needs. I do this via my concierge medicine program, telemedicine, primary care, COVID-19 testing, and COVID-19 vaccines. Good afternoon, ladies and gentlemen, and welcome to Let's Chat. Today's topic is sickle cell anemia. So let's get to it. We're going to share with you 4 tips to help avoid a sickle cell crisis in a sickle cell patient. So first, let's define what is sickle cell disease. Sickle cell disease is very commonly known as a group of disorders that affects your hemoglobin. Now, this is the molecule in the red blood cell. Red blood cells are in your blood and they help to carry and deliver oxygen to different cells and tissues throughout your body. So these cells in sickle cell are red blood cells that mishappen or cause it to break down. The cells are distorted or contorted into a sickle shape, and because of this, the cells die early and aren't able to deliver that needed oxygen to those muscles, organs, tissues, and cells that need them. So therefore, you end up having a shortage of healthy red blood cells, and we call this sickle cell anemia. Now, when those cells become sickle or distorted or contorted, they can block blood flow. When this happens, we call that a sickle cell crisis. So let's go over some of the symptoms of a sickle cell crisis and what the crisis is. It's a painful episode, usually begins suddenly, can last anywhere from a couple of days up to 7 days, usually on average. The sickle celled red blood cells clump together, and therefore they block small blood vessels from delivering that oxygen to those organs, muscles, and bones. Some of the symptoms of sickle cell include a lot of times people with sickle cell, you can tell that they're having a crisis because they have an acute infection. In addition to this, they can get pain in their joints and in their chest. They can have fatigue. They can have dizziness. And a lot of that is a result of the oxygen level being low because you have a shortage of those healthy red blood cells. In addition to this, these patients can present with blood in their urine. They can present with paleness in their skin, inflamed fingers or toes. They can have shortness of breath and yellowing of the eyes. Most of the time, this pain that they have is treated with aspirin or ibuprofen. Things that they can do, and we'll review this a little bit, things that they can do to help prevent it include drinking plenty of water, temperature control, very important in the sickle cell patient. If they get too hot or if they get too cold, this can oftentimes trigger a crisis for them. In addition to that, we encourage these patients to avoid low oxygen situations. So they'd want to be careful with mountain climbing or living in cities that have high altitudes. We want to be careful with that. So let's go over 4 tips to prevent infection in the sickle cell patient. And that includes number 1 is hand washing. Very important for the patient as well as the family and caregivers of these patients to make sure that they keep their hands clean. This helps because if their hands are clean, they're less likely to carry viruses and bacteria around this person, making them susceptible to an infection, which could throw them into a sickle cell crisis. So hand washing, very, very important. Number 2, food safety. Salmonella, which is a bacteria very commonly found in chicken, is especially harmful to children that have sickle cell disease. So very important to make sure we're cooking the meat that we prepare until it's definitely done. We want to make sure that we wash our hands, we wash the cutting board, we wash the countertops, and just in general, that's a good tip if you're dealing with meat that is not cooked in general. And I know that most of us know this, but just reviewing it here, you want to make sure that you keep those surfaces clean. Remember, uncooked meat potentially has bacteria on it that if ingested can make you sick. That's why it's important to make sure the food is fully cooked before you eat it. So washing your hands, the cutting board, the counters, all that, very important. You want to make sure in addition to that, that you're washing fruits and vegetables, no raw or undercooked eggs for the sickle cell patient. That increases the likelihood of salmonella as well. In addition to that, you want to watch out with raw and pasteurized milk. Okay, number three, third tip to avoid or prevent infection in the sickle cell patient includes staying away from reptiles. And that includes turtles, snakes, and lizards. Again, they have bacteria that can easily make a patient, a sickle cell patient specifically, go into a crisis. So we want to make sure that we avoid them. They specifically have been affiliated with causing them to have salmonella infections. So stay away from all reptiles. Not many people want to hang out with turtles, snakes, and lizards, but remember, a lot of times kids do because they have no fear. So that's something to think about as we go into the summer and we're outside more and we're going to have interaction with these turtles, snakes, and lizards, whether we want to or not. Okay, so that's tip number three. We're going to stay away from reptiles. And then number four, vaccines. Very, very, very important for the sickle cell patient. So children and adults that have sickle cell need all of the recommended vaccines to prevent them from having those infections. That includes the pneumococcal vaccine, the meningitis vaccine, the flu vaccine, as well as now the COVID-19 vaccine. So those are the four tips we're going to try to help prevent infection in a sickle cell patient. Again, hand washing for the patient, for the family and the caregivers of the sickle cell patients. Number two, food safety. We're going to make sure that we don't, that we're careful with uncooked meat and that we wash surfaces. And we're going to make sure that we cook that meat until it's done. We're going to make sure we wash our produce very well. Number three, we're going to avoid turtles, snakes, and lizards because that can put you at risk for a salmonella infection as well. And then number four, we're going to follow all the recommended vaccines, which would include and not be limited to pneumococcal, meningitis, flu, and COVID. So that's all we had to share with you guys today. Does anyone have any questions? Hey, Pretty Barbie, thank you so much for tuning in. I thought this might be helpful. We're going to try to do some things that are summer related because as we go into the summer, you know, we're exposed to different things. So we just want to keep these things in mind. So we thought that we'd hit that today about the sickle cell patient. Does anyone have any questions? Any questions at all? And if you do, let me take a page here. We are continuing to provide house calls every Monday at 6:30 a.m. on CBS 42 News here in Birmingham. We also will provide the playback for that if you don't make it Monday at 6:30. But on that segment, we answer any medical questions. So if you have any medical questions at all, please email those to us at housecalls@cbs42.com. Again, that's housecalls, HOUSECALLS at cbs42.com. And it's any question that you want answered. So definitely take advantage of that. Do you guys have any other questions? I know that it's a rainy Sunday today, but I hope that you guys are enjoying your family, have been to church and gotten to worship today. Does anyone have any other questions? Okay, so I hope that everyone is doing well. I caution you, if you're out there, just take a page here for this. Again, if you have any medical questions, please email those to us at housecalls@cbs42.com or leave a question here. Secondly, we want to make sure that we remember, I just want us to remember this. If you are vaccinated for COVID-19, there are several of the restrictions that have been lifted that the CDC is now saying that you do not have to wear a mask in various and varying environments. You can go to the CDC's website to get more information about that. You want to make sure that the card that you get from the clinic that you get your COVID-19 vaccine, that you hold on to that card. That card will be useful for you, definitely when traveling. But I know that there are different events and things that people are having, and a lot of them are asking and or requiring a vaccination card for different, and these are social things, not anything government per se related. But we want to make sure that the people who have chosen not to get vaccinated, if you've chosen not to get vaccinated, please remember they're lifting these restrictions for people that are fully vaccinated. And to be fully vaccinated, you have to have had 1 dose of Johnson & Johnson or 2 doses of Moderna or 2 doses of Pfizer. If you did not receive both doses of Pfizer or Moderna, you are not considered fully vaccinated. If you missed your dose, contact that clinic and or that physician, and they will make an appointment and make sure you get that second dose. If you're in need of a second dose of Pfizer and or want to get vaccinated, period, definitely give us a call. Our clinic number is 205-291-8842, and we're more than happy to provide you with that first or second dose. We have Pfizer. We do not mix the doses, so if you've had Moderna, we wouldn't be able to give you the Pfizer vaccine, but if you've had Pfizer and can't get to a second appointment and or need a second appointment dose because it was out of town or anything like that, give us a call. We'll be more than happy to provide it. But for the people that are not vaccinated, please remember this. They're lifting the restrictions, right? But if you're not fully vaccinated, you do not have the protection that someone does in terms of immunity if they're fully vaccinated. So it's very important for you to remember this as you see other people with their mask off. It's very important for you to continue to do those things that we know in our arsenal that has helped us over the last 1 calendar year to prevent the spread of COVID-19. That includes washing your hands very frequently, continuing to social distance, and wearing the mask. So please, guys, let's remember that and keep that in mind and remind our family members of that, because COVID-19 is still circulating presently, and we want to make sure that we help to decrease its spread. So we need to, make that differentiation between those individuals who are fully vaccinated and those individuals who've chosen not to get vaccinated as of yet and or not get vaccinated at all. Okay, so I hope that that was helpful for you guys. Anyone have any other questions? Any other questions? Any other questions? Okay, well, I hope that everyone has a happy Sunday. Again, remember those 4 tips that are going to help to decrease infection in a sickle cell patient. And that would include making sure we follow the vaccine regimen, making sure that we are washing our hands, making sure that we're avoiding reptiles, and making sure that we're washing surfaces and avoiding undercooked food, and or making sure we're cleaning those surfaces that we don't pick up a germ or a bug and pass it on to that sickle cell patient. Okay? Hi, Ms. Schwartz. Thank you so much for joining us. Does anyone have any other questions? And then please remember, again, if you have any medical questions at all, please email us at housecalls@cbs42.com so we can answer that question on air for you. I hope this was helpful. And you want to keep this information in mind, because even if you don't have sickle cell, it's very prominent in the African American community, and we want to make sure that we continue it's important for you to know about it, so that if you have a relative, family member, friend who has sickle cell, that you remember these things to help prevent spreading infection to them, if that makes sense, and or reminding them of these things so that they can keep these things in mind. Okay? All right. Well, I hope everyone has a happy Sunday. I hope this was helpful for you, and we will see you next time. Bye-bye.